centers are resourced with facilities, equipment, as well as the necessary staff. And also, if in cases where there is need for medication, they are also provided with the medicines. But we are not limiting ourselves to the amounts that have been allocated under the national budget. We are soon going to have a high-level event where we will be calling for private partners to come and support this program. Remember also that the task force is actually a whole of society task force. We have participants from the private sector, from the non-governmental sector, from churches, from traditional leaders in this whole task force. And we want also to see the same representation in terms of the resources that are contributed in fighting against the menace of drug and substance abuse. So very soon we'll be holding this high-level event. Then the capacity of the 3 new rehabilitation centers, we are still working on making sure that we have put in the necessary beds and other equipment in these 3 centers, in Victoria Falls, in Bulawayo, as well as in Kwekwe. So we can't really specify the number that will be accommodated in these 3 centers, but suffice it to say that these are quite big facilities. In the case of Kwekwe, this facility used to be the BRO, and it was disused, and I think this is quite an innovative way to use public facilities that have that are no longer being used for previous purposes for which they were used. And you will not see a BRO when you go there. You will see a proper rehabilitation center. So the capacities, definitely, we will know as we finish the process of making sure that these facilities are functional. The third question relates to psychosocial support. Remember, this is a responsibility for the pillar that does psychosocial support, as well as societal reintegration of those who have been helped with rehabilitation. And this is particularly under the Ministry of Public Service, Labour and Social Welfare. This is a ministry that has very much experience in the area of psychosocial support. This is the ministry that has social workers in it, and has a lot of experience. They have also the architecture to follow up and make sure that these people who have been reintegrated are actually not falling into recidivism. But at the same time, the same ministry is running a program for livelihoods to support those who have been integrated so that they can be self-reliant. So it's not just psychosocial support, but it's also supporting these individuals so that they can stand on their own 2 feet. I thank you.